Man should get.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago. We brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. We have Bruce running the studio today, and he's fantastic. We're live on WABC, and we're talking about health care and how to live better and how to live longer and how to live with a better quality of life. This is Radiosurgery Hour. My name is Dr. Lederman, and if you have questions, please call us. We're at 1-800-848-9222. 1-800-848-9222. So we have lots to talk about today, and again, if you have questions, please feel free to call us. We are live, and we're happy to take your questions. The point of the show is really to give you cancer news and to provide examples of real patients, what they've done, and what we've responded to our patients, so you can learn how different medicine is depending on who's your doctor, where you go, what facility you're at. You'll see. The first patient I want to talk about is a woman, 75 years old. She's a black woman with 5 kids. And believe it or not, she was my patient almost 10 years ago. 10 years ago, she came to me with a cancer of her foot. And at that time, all her doctors wanted to amputate her foot. She came to me, she heard about non-invasive treatment, and we treated that cancer of the left foot. And guess what? She's got her foot. She's cancer-free. She walked in my office. She is very happy. So number one, she made a choice years ago about surgery versus radiosurgery, non-invasive treatment for her foot and how it changed her life. She's walking, she has her foot, she has 5 toes, her foot is intact, and she's happy. Well, why did she come this week? Well, actually, she came this week because over the last 2 months, She's had a lump in her breast. She's had distortion of her breast. She's had bleeding from the nipple. And she went to her doctor, the same doctor who's been taking care of her for 10 years. This woman won't have a mammogram, and she won't, or so far she's refused a biopsy, and she comes to me, and can we do the same in her breast that we did for her foot 10 years ago? She loves the fact that she kept her foot. She wants to keep her breast. She came to me just this week. She came actually yesterday. I examined her. Her foot is doing great. In her breast, she's got a mass about the size of 3 inches in the right breast. It's caused some distortion of the breast, so the 2 nipples are not equal. The nipple on the right side is a little bit inward pointing. There's some blood. There's this mass. I spoke to her about all the options, and I told her, she's 75 years old, I told her it'd be best to get a biopsy. She said she doesn't want anything that causes pain, nothing that causes pain. She doesn't want a biopsy. I told her, well, we have many people who come to us, and they say the same thing, and obviously people don't like pain. And after a long conversation, probably half hour, she agreed if we could do a biopsy without pain, with a little needle, that it would be better. She would know what disease she's fighting. She brought in her daughter, a beautiful woman came in, and the daughter understood how important it is for her to know, is there a family history of breast cancer or not. We arranged for it to be done all yesterday. So up till then, for months, she refused everything, biopsy, imaging. Yesterday, we got imaging of the breast, showed this mass consistent with a cancer, and we got the biopsy. And by early next week, she'll have the answer. She'll have the report in her hand, and she can make a decision about cancer or not, breast or not, treatment or not. Now, she has a lot of gratitude since she's been able to keep her foot after being treated with cancer using radiosurgery 10 years ago. And she's, I think, leaning towards keeping her breast using the same technology for the breast that she used for the foot. Another patient, and we have lots of patients this week with kidney cancer. It's not such a common cancer, but wow, did we have a lot of patients. This woman came to us. She'd already had bleeding from the urine for 2 years. Recently, she had a scan of her body, which showed a mass in the kidney. Now, remember, when you have bleeding in the urine, it can be something wrong from the kidneys, which make urine, in the ureters, which pass the urine on to the bladder, or the urethra. Any of those sites can have an abnormality. Now, a lot of blood in the urine is just from an infection, and you can treat the infection, and the bleeding goes away, the infection goes away, and home free. This woman, no. She had a mass in the kidney. It was biopsied. She saw a variety of doctors. They wanted to remove the kidney. Hey, you're getting a scene here that a lot of people want to do surgery, and patients come to us to avoid surgery and to keep their organs intact. Well, it often works. Our success rate for kidney cancer in the kidney or metastatic sites is about 90%, where we aim to beam for the rest of the life of the patient. So she's decided to keep her kidney. Yes, she has biopsy-proven kidney. She had a biopsy of the kidney elsewhere, already done. They wanted to remove her kidney. We offered to save the kidney, and we offered her all the options. We're proud to offer all the options because we think our options are the best. Our option of radiosurgery, which we specialize in, is non-invasive. There's no cutting, no bleeding, no anesthesia. Patients come to our department. We're located in a super convenient location, 38th and Broadway, by all the subways, buses, trains, Penn Station, Grand Central, PATH, Port Authority. People come in, get a treatment, lasts about 20 minutes. Then they get up off the table. There's no cutting, bleeding anesthesia, so they feel perfectly fine. And go about their business. Go back to work, or go to lunch, or go shopping, or go home, whatever you want. So that's what's going to happen to her. We did the mapping out of her kidney cancer treatment this week. And next week she'll start the actual treatment. Each treatment takes about 20 minutes. And how can we be confident about the data? Well, we've treated many, many thousands of patients, and we follow our patients, so we can report to each patient what the likelihood of success is before they start, not afterwards. Another woman came to us this week, 85-year-old woman with rectal cancer. She had rectal cancer 2 years ago. She had surgery and chemo elsewhere. And she came to us because she didn't like endoscopy. She just couldn't tolerate endoscopies anymore. And she's having a memory loss. So she's gone to one of the big hospitals in Manhattan. She doesn't like the fact they put her to sleep and that they haven't evaluated her memory loss. So we got all the records together. She came in just this week, 2 days ago. I examined her. We're going to get her staged up, which means we're going to find out if there's any cancer or not. We're also going to check her brain to see why she has a memory loss. She's been going elsewhere for a year, and they haven't addressed that topic, which bothers her a lot. So we're going to address her from head to toe, and then she'll come back, and we'll report to you what's happened to her when she comes back to us. We had a man coming in this week, a Spanish man. Actually, a urologist sent him to us. He's from Puerto Rico. He's a 71-year-old Hispanic man. He's separated. He has one child. His PSA was 3.9. Had an abnormal physical exam. So his PSA, a lot of people would say, would be normal, less than 4. But there's something that's abnormal, and that is his PSA had gone up, even within the normal range. While it's still less than 4, it had gone up to 2, to 3, to 4. And his physical exam was a little abnormal. He had a biopsy. His biopsy showed a Gleason 6 cancer. So he's a low-risk patient. Low risk means the chance of successful treatment is exceedingly high. With us, his success rate for prostate cancer with a Gleason 6 PSA 3.92 is about 95%. Chance he'll be cancer-free. Now, his other doctors elsewhere found that he had an elevated CEA, which is a cancer marker for other cancers. It's actually one of the most common cancer markers, but no one did anything about it. So we try to take care of the whole patient. His CEA was 109, so we're repeating that to make sure that's correct. And then, if it's still high, we'll work him up for something else, because there may be a hidden colon cancer or lung cancer or pancreas cancer or other cancer in his body. We don't know why the doctor got all these cancer markers. Usually a doctor gets a cancer marker just for the cancer the patient has. So this man, he's choosing to proceed with radiosurgery for prostate cancer with a PSA 3.9 Gleason 6. We're working him up for the other issues as well. And again, we'll report to you and tell you why he had this high CEA. My name is Dr. Lederman from Radiosurgery New York. We're live at the WABC studios. Our number is 800-848-9222, 800-848-9222. If you have questions, please call us. We're going to have a short break. You're going to hear from a few voices about the work that we do, and then we'll be right back to talk more about what's going on in our life and possibly to help your life. Here we go.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA